Ying. It's an intersecting point of the foot Yangming and foot Shaoyang meridians. Ying means to welcome, to receive. It got its name because it is located where the Ying pulse is felt. The name also stresses the point's function of receiving the qi of the 5 visceral. Location: in the anterior region of the neck, at the same level as the superior border of the thyroid cartilage, anterior to the sternocleidomastoid muscle, over the common carotid artery. Location method: to locate the point, ask the patient to turn the head to the opposite side to reveal the sternocleidomastoid muscle. The muscle will be more prominent when the head is turned with resistance applied at the chin. The point is where the artery pulsates, lateral to the laryngeal prominence. Avoid the artery when needling. The indications: first, swollen and sore throat. 2. Scrofular goiter. 3. Hypertension. 4. asthma. Needle perpendicularly 0.3 to 0.5 cun. Precautions: needling the point with the patient in a supine position is recommended. When needling the carotid sinus, avoid strong stimulation to prevent collapse, vertigo, sweating, and decrease in blood pressure caused by hyperreflexia of the sinus. And the vagus nerve is behind the common and internal carotid arteries. Avoid puncturing the nerve. It is not advisable to lift or thrust the needle strongly. Strong manipulation can injure the vessels. And the scarring moxibustion is forbidden as the point is located near major blood vessels. Stomach 12, 缺盆. It is located in the supraclavicular fossa, which was referred to as 缺盆, which looks like a notched basin. Location: in the anterior region of the neck, in the greater supraclavicular fossa, 4 cun lateral to the anterior median line, in the depression superior to the clavicle. This point is a landmark to locate points. Stomach 21, 梁门. 梁 means wooden beam. 门 means gate. An accumulated mass at the epigastrium is known as 梁, and an accumulated mass between the umbilicus and epigastrium is like a supporting beam. This point can resolve accumulation and stagnation. It is an important gate through which stomach qi enters and exits, so it is named 梁门. Location: on the upper abdomen, 4 cun superior to the center of the umbilicus, 2 cun lateral to the anterior median line. How to find 2 cun? Can you find it? Indications: stomachache, vomiting, poor appetite, and abdominal distension. Manipulation: needle perpendicularly 1/2 to 1 cun to produce local soreness and heaviness in the stomach. Precautions: the patient's body fat should be considered when puncturing this point. Do not penetrate the parietal peritoneum to avoid piercing the abdominal cavity and injuring the organs. Stomach 25, 天枢. The frontmost point of the large intestine. 天 means heaven, 枢 means pivot. 天枢 is the ancient name of the central star in the northern dipper. The region above the umbilicus corresponds to the heaven, that below corresponds to earth. The point is beside the umbilicus and in the center of the body, as a juncture of celestial and earthly qi. It coordinates ascending and descending qi movements, so it is called Tian Shu. Location: on the upper abdomen, 2 cun lateral to the center of the umbilicus. You know, between the 2 nipples is 8 cun, and one side is 4 cun and a half. You can find 2 cun. Indications: 1. Abdominal pain, abdominal distension, borborygmus, diarrhea, dysentery, constipation, intestinal abscess. 2. Irregular menstruation, dysmenorrhea. 3. Edema. Since this point is between the upper and lower abdomen, so it can be used to treat both upper and lower abdomen disorders. A group from Beijing, an Institute of China Academy of Chinese Medical Sciences, aimed to determine the efficacy of electroacupuncture for chronic severe functional constipation. They enrolled 1,075 patients from 15 hospitals in China. Patients of electronic acupuncture point receives needling at stomach 25, spleen 14, and stomach 37, and the sham electronic acupuncture group, EA group, receives needling at non-acupoints over 8 weeks. Totally, they received 28 sessions treatments. Complete spontaneous bowel movement, CSBM, was the primary outcome. Results showed the change from baseline in mean weekly CSBMs during weeks 9 to 20 was increased than sham group. Acupuncture is safe and effective for the treatment of constipation. Manipulation: first, needle perpendicularly 1 to 1.5 cun, or you can use moxibustion for 15 to 30 minutes. Moxibustion can be performed until the skin feels warm and comfortable or turns slightly red to strengthen the body and to preserve health. Insert the needle slowly. Do not lift and thrust too quickly or forcefully to prevent injuring the intestinal tract. Needling depth is determined by the thickness of the abdominal wall. We should avoid puncturing the parietal peritoneum. Stomach 29. 归来. 归 and 来 both means return, signifying recovery and restoring. The point got its name because it treats and restores testicular disorders and uterine prolapse, may also because it treats menstrual block and thus aids the return of the menstrual cycle. Location: on the lower abdomen, 4 cun inferior to the center of the umbilicus, 2 cun lateral to the anterior median line. Indications: 1. Amenorrhea, prolapse of the uterus, dysmenorrhea, leukorrhea, irregular menstruation. 2. Lower abdominal pain, hernia. Manipulation: needle perpendicularly 1 to 1.5 cun. There will be soreness and distension on the lower abdomen. Or needle 1.5 to 2 cun obliquely and slightly toward the pubic symphysis to regulate menstruation and stop leukorrhea.